Going to talk about something that's much in need of discussion. It's in the national spotlight these days. Obesity is a problem, but the fact is millions of women are starving themselves, suffering from debilitating, sometimes even fatal eating disorders like anorexia or bulimia. And increasingly, experts say it's not just young women who are struggling with these disorders. In fact, the statistics show more middle-aged women are struggling than ever before. Here to talk about this growing problem is Jodi Clarke, a counselor who specializes in this area. First, we're going to talk about, most people probably think this is a problem that affects young women,
yes,
but it's actually affecting women 35 and older, which
That's
is
right.
an interesting statistic. Tell us about this.
Yes. I think eating disorders traditionally have been known to affect adolescents and early 20 college-age students, but there is more research and reports showing that women ages 35 to 65 in particular are seeking treatment more often, and it's just growing within the last 5 to 10 years. There are even some residential treatment programs nationwide that are specializing in this target population because the need for services is growing so much.
What's also interesting is because there's such a national focus on obesity and people getting healthy. There's a lot of encouragement on people dieting and getting healthy. Do you think this is actually contributing to the issue?
I think it is a little bit in terms of just there's so much information out there for people to count calories, track their progress and weight loss and things like that. I think somebody with an eating disorder mindset, though, might use those tools in a much different way than somebody with a healthier mindset in view of their body and relationship with food.
What do you think this says to the daughters of women who are starving themselves or throwing up after they eat?
I actually think that one of the best ways to help not only prevent eating disorders from growing so much, but to help those who are already struggling is to model appropriate behavior, you know, to have a healthier body image and not equate your self-worth with your physical appearance. I think there's so many times, just even as women, especially in that 35 to 65 range, you know, they're talking about dieting tips still, and maybe some kind of social comparison with other women, and I just think it's time to stop that, especially at that age. There are so many positive things happening in our lives during that time. I think the best thing we could do for ourselves and for the younger generations is to show that we're comfortable with this age, and we don't always have to be striving to be 30 when we're 60 and all these things. So I think just a comfort of where you're at in your life and just living that best possible life at that age is the best measure.
Great advice. You have the life experience at that point. It's time to embrace it and enjoy it.
Absolutely.
If somebody has a loved one or a friend that they're concerned about, how do they approach that topic?
I think the key is to, if you do have concern, to address it as early on as possible. I think there are a lot of times, especially with eating disorders, where it's progressing and people are even receiving compliments as a result of their behaviors. So they might receive compliments on losing weight, oh, you look great, and all that, not really understanding there's much more at play here. So if there are behaviors that are of concern, if you know, excessive use of diet pills and laxatives, trips to the restroom, just very restrictive behavior with food, I think it's important for loved ones to say, hey, I'm concerned about you, you know, if you need somebody to talk to, and be specific. Say, I've noticed these things, and this is concerning. We want you to be healthy, and I think the key is just as soon as you notice something, just mention concern and try to intervene earlier before it's very quickly can spiral. By the time you're seeing physical symptoms of maybe brittle hair, hair loss, dental issues, things like that, it's well progressed at that point. So if you do see behavioral concerns, it's appropriate to intervene gently out of true concern to say, we want you to be healthy, we care about you.
Well, Jodi Clarke, such an important topic that many people probably didn't know affect this age group. So we appreciate you discussing it with us this morning.
No problem.
Thank you.